Last week, some people gathered at the Grandview Farm for a critical training on how to help in the aftermath of a tragedy that results in injured people. It was a Stop the Bleed training hosted in partnership by the Burlington Area Chamber of Commerce and Lahey Hospital and Medical Center.
So the Stop the Bleed program is a national initiative to teach bystanders to become first responders in the event of a mass casualty where there's expected to be people that have uncontrolled bleeding, to be able to apply the principles that we would do in the hospital setting at the moment the person is injured to increase their survivability until they get to a trauma center.
Those behind the program emphasize the need for regular citizens to be equipped with this knowledge in an emergency.
Well, I think in light of some of the things that are happening in today's world, when we talk about the police and the fire department being the first responders, actually it's the bystanders that are the first responders. And today we're going to be educated on how to act as that first responder and potentially save people's lives.
For people injured and bleeding, having someone provide care as soon as possible can make a huge difference.
So every minute counts with a bleeding victim. So we want to make sure that we stop the bleeding right away so that this person doesn't lose a significant amount of blood so that it would become an unsurvivable injury by the time they made it to an emergency care center.
Absolutely. So we know that not only minutes count, but seconds count. And we know that early access to care, proper equipment actually does make a difference. It all started with CPR and AEDs and now bleeding control. We know that the sooner that a person can get help, the better they're going to do overall. So if we can arm the residents with this type of equipment and these resources, we know they're going to do a lot better.
During the training, participants are taught how to recognize an injury and begin providing assistance while also staying safe themselves.
Foremost, we teach people that they're the most important person, the person that's going to be the responder. Make sure that they're ensuring their safety. We don't want them to go into an unsafe situation, whether it be a mass shooting or a motor vehicle crash where they could potentially become a victim themselves. Also to protect themselves from any exposure to body fluids, if at all possible. And then to recognize the areas in the body with life-threatening hemorrhage. And depending on what they have available to them, whether it be a trauma first aid kit or just the shirt off their back, on how to actually intervene for those areas of bleeding.
There are also materials and items people can assemble and store in their homes, businesses, or vehicles to have at the ready should an emergency arise.
So definitely have something available with several pairs of gloves in several different sizes. That way, if someone's there to help you, help a victim, they're also be able to be protected. Gauze, it doesn't have to be the hemostatic dressings that we talked about, although those are great, but gauze that you could get at CVS or Walgreens or something, several different types of gauze. But your hands are really the most important tool that you have available. So understanding the principles of compressing a wound, and if you've had the proper training, if you can get access to a tourniquet, that would be great too for those victims that are bleeding in their arms or their legs.
For anyone interested in learning more about this, the resources are out there.
Anywhere you're located, if you go to bleedingcontrol.org, and then it gives you a lot of information about the bleeding control program itself. But you also want to look for a course that's being offered. So you could certainly just do course in your area. It's a drop-down menu. You can put in whatever state you're in, and it's going to give you a list of multiple different courses that are being offered throughout the country.
Finally, for anyone who feels they would be unequipped to help in an emergency, the trainers of this program want you to know that you too can get a little training and knowledge and possibly be able to use it one day to stop the bleed and save a life.
I think it's really important for people to realize that everyone can be empowered and that you don't need to take a 100-hour or 200-hour EMT course to save a life, that it only actually takes, in this case, only about an hour. A CPR class is only 2 hours. So that, and actually everybody can do it. It's not as hard as people think. And we encourage people to at least give it a try. And they'll realize and soon realize that it's actually pretty easy and that you do actually make a difference.
At the Grandview Farm, I'm B News Director Rich Hosford.